And welcome back into Medical Monday here with Dr. Carrie Gannon. We are talking about common foot problems. As we started the show, and I've said this already a couple of times, I felt like I was getting a personal consultation with Dr. Gannon because I think so many people can relate to so many of these problems that we've been talking about. We've been talking about, just to name a few, heel pain, plantar fasciitis, ingrown toenails, bunions, hammer toes, foot and toenail fungus. Diabetes is one of the #1 causes of amputations we were talking about a little bit earlier. We're also going to talk about ways that you can help these situations, certain ways that you can prevent them from time to time, but we want your calls. So this is your forum. There's a number on your screen, 615-737-7587 is the number to call. Now, one of the things that we were talking about as we went into the break, we were talking about plantar fasciitis, heel pain all being part of the same thing. One of the things that I noticed at the gym, people, once they go into the locker room and they're taking their showers and that sort of thing, is some are worried about making sure they have their flip-flops on in the shower. Some don't worry about that for fungus in there.
Sure.
How important is that?
I don't think that's the most important thing. I don't think you're going to catch a ton of stuff if you go into the shower at the gym without the flip-flops. Maybe some viral warts and stuff like that, but fungus, you're probably not really catching that from the gym. You know, humans, we are covered in fungus. Bacteria, mold, yeast, we're pretty gross. But we're covered in fungus, and basically we're carrying our own fungus with us everywhere we go. And when we have toenail fungus, 99% of the time it's because our own fungus has proliferated and gained an advantage underneath our toenails. So you're not truly catching toenail fungus when you go to the gym and don't wear your shower shoes.
Okay, well, that is good to know as well. We do have a lot of folks on the line with us right now. We're going right back to the lines. Mike is on the phone with us. Mike, good evening. Do you have a question or a comment for Dr. Gannon? Are you with us, Mike? Can you hear me, Mike? All right, we are going to check that connection and we will get back hopefully very soon with Mike. Now, another thing that I was talking about too, or asking you about regarding toenail fungus is, how do you catch toenail fungus?
Sure. Like I said, you don't really catch toenail fungus. You actually already have the fungus on your body, and what will happen is the fungus will gain an advantage on the toenail, and when it does that, it's a perfect environment for the fungus to proliferate. It is a dark, damp environment. It's sort of furthest away from our central supply, so it's the last thing that our immune system focuses on, and it will gain an advantage and proliferate underneath the nail. It's very, very hard and very challenging to eradicate completely because it's part of being human. We're supposed to have it. There are multiple treatments for it, though. Do you want to talk about those right now?
Sure, absolutely.
So the three main treatments of toenail fungus are going to be topical, oral therapy, and laser therapy. Topical is kind of the least effective, but most people like to do the topical because it's something that they can do. You have to apply it every day for 9 to 12 months, and you have to wait 9 to 12 months as the nails grow in to see if they grow in clear or not. And then you need to maintain it by continuing to apply maybe every week. It's about a 20% success rate. It's not very high. The oral medication has an excellent success rate. About 85% of the time we treat it with oral medication, it does get better. Again, you have to wait 9 to 12 months as the nail grows in to see if it will grow in healthy or not. Laser therapy is also very effective, not quite as effective as the oral medication. The oral medication comes with some potential risks with liver function, so we like to test liver function to make certain it's healthy. The laser, you'd get a monthly treatment with the laser, and again, you have to wait 9 to 12 months as the nail grows in to see if it grows in healthy or not. A couple of things, nail damage can look just like nail fungus, and so I'll have people come in who have been on oral medication for 3 years and their toenail fungus won't get any better. The reason for that is they've never had toenail fungus to begin with, and we'll do a nail biopsy, take a sample of the nail, and it'll come back as nail damage. And at that point we know, you know what, it's not even worth your time or your money to treat this as fungus. So it's important always to make certain that it's true nail fungus even before you treat it. Otherwise you'll waste a lot of time and resources to treat something that could be nail damage from shoe gear.
Well, and that's why it's important that they come in to see you. We were talking too during the break. University Foot and Ankle is where they can find you. Mm-hmm. And it's important that they come in for that. Do they have consultation? Is it good to just set up the appointment to come in and see you?
Sure.
And check out what might be wrong?
So I usually initiate treatment the first day. I don't like to have you do a consultation and then come back again. A lot of times we can initiate treatment right then and there and go ahead and get the ball rolling to get you better.
Now, when you were talking too about some of the treatments and that sort of thing, what about, we talked a little bit going into the break, hammer toe. So
Sure.
what are some of the treatments for that, and what is hammer toe?
So a hammer toe is typically where the digits start to contract or become bent. Frequently that's from a muscular imbalance where the large muscles of the leg overpower the smaller muscles of the foot. The treatment for that, there's a multiple conservative measures, inserts, orthotics, some bracing will help straighten the toes out, shoe changes of course, but none of those are curative. The only cure for hammer toes is surgical, and we do surgery on them quite frequently for people that are prepared to do that. Otherwise, conservative management can make you feel better, can slow the progression of the hammer toe, but it doesn't take it away completely without surgery.
Okay, and then back to even kind of talking about a timeline, when you're talking about oral medications, even when we talk about fungus and that
Sure.
sort of thing, how long are you on the medication normally?
For the oral medication for toenail fungus, you'll take one tablet a day for 3 months. That's for the primary oral medication we use. There are others that are used a little bit differently, but it's 1 tablet a day for 3 months, and then again, you have to wait for 9 to 12 months as the nail grows in to see if you have the results or not. The reason for that is the medication doesn't cure the fungus immediately. What it does is it clears the nail as the nail is growing in, and unfortunately our toenails take about a year to grow back.
Okay. Well, if you're out watching this evening and you're thinking you have something that is painful when you walk, it's painful when you work out. As I was telling Dr. Gannon when we started the show, I had this about 2 years ago, and I realized that I had plantar fasciitis. And one of the best things that I did was I sought medical help, and I found ways to make it more manageable. So let's talk a little bit about, because I know it's very, very common for people to have plantar fasciitis. So what are some of the ways that you can make it manageable, keep it manageable?
Again, that's with the stretching, the icing, the inserts, the shoes. Anti-inflammatory medication when you need it. A lot of mistakes people make will be to heat it, or they'll wear really soft, flexible shoes, and that just makes it even worse. There's a trend now with these low-profile, minimalist shoes without a lot of support. I love them because I get a lot of patients from them, but they're really not good for most people's feet, and they're a large contributor to plantar fasciitis. So I'd say shoe gear is probably the most important.
So when you're going into the sporting goods store to find that perfect pair of shoes, what should you be looking for?
So I don't think that there's one brand of shoe that is for everyone. Not every brand works for every person. Typically the shoe that's best for you is the one that fits appropriately, that is relatively rigid, and has a little bit of a heel. So for example, for a workout shoe, I prefer a true running shoe versus a really flat court shoe or some of these lifting shoes. I know a lot of the people that do a lot of heavy weightlifting or CrossFit like the flat, low profile, very flexible shoe because they're taught that they can retrain the muscles of their feet. It doesn't really work that way, although they teach that, and a lot of times I'll see people that have been wearing those shoes and all we do is switch their shoe gear and they can continue that activity but with the proper shoe gear for their foot, eliminating that sort of flexible flat shoe that's sort of the trend right now.
And the running shoe has more support. It has more of an arch to it.
It depends on the running shoe, but typically yes. And again, you're looking for a shoe that is more rigid and a little bit of a heel, and that's typically your running shoe. Now, that's not all brands of shoe. If you can take a shoe and really bend it, then it's too flexible and probably not supportive enough for you. If it's difficult or challenging to bend with your hands, it's got a lot more support.
Okay, and what about the size in the shoe? Should you, if you're an 8.5, do you buy the 8.5 or do you go a size larger?
It depends on what you mean by 8.5, right? A lot of times we go to the shoe store now and they just throw a shoe at us, whatever size we say we are. Most of us haven't measured our feet since high school or even before that, and we've been saying we're this size shoe for a very long time. People are always surprised when they come to my office and I measure their feet, and typically their shoes are about 2 sizes too small for them. You should when you're measuring for your shoes, you have the Brannock device if you could find it. Right. You stand on it, bear full weight, have your feet side by side. The longest toe, you always want to put your thumb down and measure the distance after the longest toe, and where your thumb ends, that's the shoe size that you are, not where your toe ends on the device.
Oh, see, good to know.
That measures for the outside of the shoe. You want your foot to fit inside the shoe.
Right. Now, should you, anytime you go in to get shoes, should you always get measured?
You should.
Every time? You
should get measured every time you buy shoes. Over time, our feet change in shape and size. Our feet are actually larger at the end of the day than they are at the beginning of the day. So the shoe that might have fit you nicely at the beginning of the day is likely too small for you by the end of the day because our feet naturally swell just a little bit. So the shoe should be more loose fitting at the beginning of the day, and you should have your feet measured at the end of the day properly for shoes.
Okay. Now, another thing, we see these advertised a lot, but some of the stores that are devoted to, you know, those kind of comfortable shoes, comfort shoes, good feet shoes, that sort of thing. Are those good to go for these kinds of problems?
In some situations, I would say yes. I would also say that there is a lot of overcharge, or what I would say, charging a lot of for something that you can get elsewhere for something for not as expensive. I'm not disparaging them. A lot of times these stores do the best job measuring people, and they have the best quality products. But I've had patients go in and spend $900 on a series of inserts that they probably could have done for much less expense.
Okay.
And so for me, that's a little bit frustrating, because you can get people better a lot more quickly without spending quite so much money.
All right, we're going to talk about inserts, but we do have to take a break right now. You are watching Medical Monday. We are talking about common foot problems. We want to hear from you. If you have questions, comments, just give us a call. You can see the number right there on your screen, 615-737-7587. We'll take a break, and Medical Monday will continue right after this.